and today we'll be talking about Ebola virus, particularly the Ebola virus disease. So right here is just a picture of the virus itself. Um, Ebola is a virus that causes problems with how your blood clots. It is known as hemorrhagic fever virus because the clotting problems lead to internal bleeding as blood leaks from small blood vessels in your body. The virus also causes inflammation and tissue damage. So, for the contents, we're going to be talking about the history, causal agent, transmission, epidemiology, pathogenesis, signs and symptoms, diagnosis, treatment, and prognosis of the Ebola virus or the Ebola virus disease. So, the history. So, Ebola virus disease first appeared in 1976 in two simultaneous outbreaks, one in what it is now Nzara, South Sudan, and the other in Yambuku, Democratic Republic of Congo. The latter occurred in a village near the Ebola River, hence the name Ebola. So, right here you guys can see in the map the different types of the Ebola virus species that was sorry. Basically, these are the cases of the outbreak of the Ebola virus with the different types of species, which is the Zaire, Sudan, Typhus, and Budimbugyao Ebola virus. Those are the four that causes the disease, the Ebola virus disease in human beings. So, the causal agent. So, the origin is unknown. Scientists believe that it is animal born and most likely comes from bats, which transmit the Ebola virus to other animals and humans. There is no proof that mosquitoes or other insects can transmit the virus. Once infected, a person can spread the virus to other people. So right here you guys can see an animal to animal transmission, and then once the animal is basically infected, the human then becomes infected once they eat uncooked meat of the virus or if they touch like fluids from them, and then so transmission. The Ebola virus is not as contagious as common viruses such as colds or the flu. It is not spread through air, water, or food. The Ebola virus is spread through direct contact with blood or body fluids, objects, infected fruit bats or non-human primates, or semen from a man who recovered from the Ebola virus disease. So EVD means Ebola virus disease, just so you guys know. So yeah. So right here is just basically a picture again of how the Ebola can be transmitted. So right there. Not this. So epidemiology. So this one is a pretty long one. I'm sorry. So the first case of Ebola virus infection were reported in Zaire, known as the DCR or Democratic Republic of Congo, in 1976. There were 318 cases and 280 deaths, an 88% case fatality rate. Transmission in this outbreak was traced back to the use of contaminated needles in an outpatient clinic at Yambuku Mission Hospital. Since then, frequent outbreaks have occurred in Central and Western Africa. So as I said, the most common species of Ebola virus responsible is the Zaire Ebola virus. The second is the Sudan Ebola virus. The Zaire Ebola virus was responsible for the outbreak that started in West Africa in 2014 and finished in 2016. It was first reported in March 2014 and is the largest outbreak since the virus was first discovered in 1976. Genetic sequencing has shown that the virus isolated from infected patients in the 2014 outbreak is 97% similar to the virus that first emerged in 1976. It is also responsible for smaller outbreaks in the DRC from 2017 to 2021. The Zaire Ebola virus has a reported case fatality rate up to 90% in previous outbreaks. Direct comparison of case fatality rates between different Ebola treatment centers and outbreaks should be interpreted with caution, as many variables can introduce bias and skew even large cohort data. The case fatality rate during the 2014 outbreak was up to 64.3 in hospital admissions, falling to 31.5 in sound treatment centers in West Africa, and around 20% in patients managed outside West Africa. In contrast to this, the Sudan Ebola virus has a lower case fatality rate of 53% to 65% in previous outbreaks, with the largest outbreak occurring in 2000 in Uganda, 425 cases. There has only been one outbreak of Bundibugyo Ebola virus in 2000 in western Uganda, and this outbreak had a case fatality rate of 25%. So, pathogenesis. So, how does the virus go into our body? So, Ebola virus enters the patient through mucous membranes, breaks in the skin or parenterally, and infects many cell types including monocytes, macrophages, dendritic cells, endothelial cells, fibroblasts, hepatocytes, adrenocortical cells, and epithelial cells. The incubation period may be related to the infection route, 6 days, 6 days for injection versus 10 days for contract. Ebola virus migrates from the initial infection site to regional lymph nodes and subsequently to the liver and spleen and adrenal gland. Although not infected by Ebola virus, lymphocytes undergo apoptosis resulting in decreased lymphocyte counts. Hepatocellular necrosis occurs and is associated with dysregulation of clotting factors and subsequent coagulopathy. Adrenocortical necrosis also can be found and is associated with hypotension and impaired steroid synthesis. Ebola virus appears to trigger a release of pro-inflammatory cytokines with subsequent vascular leak and impairment of clotting, ultimately resulting in multi-organ failure and shock. So right here is just basically a picture of the overview of what happens. So right there to here and then to here. Sorry, I'm not very good at explaining, but later I will have a video to show you guys of how it works. So signs and symptoms. So symptoms may appear anywhere from 2 to 21 days after contact with the virus, with an average of 8 to 10 days. The course of the illness typically progresses from dry symptoms initially such as fever, aches and pains, and fatigue, and then progresses to wet symptoms such as diarrhea, vomiting as the person becomes sicker. So right there, fever, aches, and whatnot. So right here is just basically a picture also of the symptoms of the Ebola virus. So for the diagnosis, we use PCR, ELISA, or the Ebola antibody testing IgM or IgG class. So the PCR, this molecular test look for Ebola virus RNA in a blood sample. RT-PCR can be used with saliva samples in acutely ill individuals. The Ebola antigen tests, they typically can detect antigens within a few days after symptoms. So yeah, and then the Ebola antibody testing IgM or IgG class, these tests are used to detect Ebola antibodies or immune proteins in a blood sample that develop in response to the infection. The IgM class of antibody develops first, while Ig develops later. Antibody tests in general are best at detecting Ebola later in the illness and are often used in investigating Ebola outbreaks. So yeah, it is pretty hard to diagnose Ebola virus because, as you can see, the symptoms are kind of the same with like typhoid fever or malaria. So it is really hard to detect Ebola virus, but these are some of the ways they are able to detect it. So treatment, as you can see, there's treatments, but there's no cure. So in America, there's 2 vaccines that have been approved by the FDA, which is the Imazeb and the Ebanga. So these 2 vaccines are particularly good for the people who has Ebola virus because of the Zaire species. So with the other species, it doesn't work, and only 18 people and above can use it. The So this two ones is from Europe, and it's Deno and Envavia. So basically, they first inject you with this, and then inject you with this one, and this one is helpful for the children 1 year younger. I think 1 year younger. Sorry, not so not like the other two where you can only do use it for the 18 and above. This one you can use for the kids, I guess. So other basic interventions is providing fluids and electrolytes, using medication to support blood pressure, reduce vomiting and diarrhea, and to manage fever and pain, treating other infections if they occur. Basically, you treat what they have. So if they're having diarrhea, if they're having fever, then you treat them based on what symptoms they have, because there's really no cure for it. So prognosis. Sorry. So the deadliest species is the Zaire Ebola virus, which has a 90% case rate of fatality. Younger children, 5 years of age, and adults over 40 years of age have a higher mortality rate compared with adolescents and younger adults. Women have a slightly better survival rate compared with men. Have high viral load, acute kidney injury, and neurologic involvement are also predictors of poor outcome. Early intervention and access to quality treatment, as well as the provision of consistent supportive care and frequent patient reassessment, are critical to a patient's recovery. So right here is just a picture of the proper way to do a burial if the patient has Ebola virus disease, because as you know, they can still have fluids, and that can be in contact with people who's handling the disease, so you have to be careful. So right here's the video that I was talking to you guys about. It's gonna show you how it works, pointer options, sorry. So I don't know why the video is not working. Let's see this. So right here is the video. Why is it not working? Sorry. So this is the mechanism of the Ebola virus.
The Ebola virus is a highly aggressive
Sorry.
The Ebola virus is a highly aggressive virus that is transmitted through bodily contact with an infected, symptomatic individual. The Ebola virus enters the body primarily through direct contact of mucous membranes, like the eyes, or through abrasions in the skin. When inside the body, the virus fuses with tissue cells, invades them, and releases its genetic content into the cell. This is similar to many viruses, wherein the viral RNA uses the host cells to generate copies of itself. The genetic material takes over the cell machinery to replicate itself. New copies of the virus are formed, released into the system, and dispersed. This also causes the cells to explode, sending infectious particles flying. Ebola then overpowers the immune system. The very cells that are meant to fight infection are used as carriers to spread infection to other body parts, including the liver, spleen, kidneys, and brain. The virus attacks almost every organ and tissue in the human body, resulting in an overwhelming inflammatory reaction. This is what causes sudden flu-like symptoms that are the first signs of Ebola.